We're a little too familiar with the supersize selections at the drive-thru, but with swimsuit season right around the corner, many of us really need to summer size our bodies. How many of you are brave enough to get out there on the beach with a bathing suit? All right, bikini. All right, well, the two 15-year-olds in the audience are like, me. Okay, well, here with the plan to get your body back in shape in 40 days, please welcome a slimmer cosmetic surgeon, Dr. James Kern, and patient counselor, Tony Navarra Kern. Hi. You are slimmer. Okay, so what prompted you to decide that you need to lose some weight?
Well, I was up a little bit over 300 pounds, and I had until my late 40s, I'd been roughly 185 pounds, 190 pounds. So I'd really put on the weight as I got older, and I just felt breathing easier, just living life easier. I needed to lose some weight.
Yeah, and the way that you did it is something that is causing quite a buzz right now in the industry. And can you explain what it is that you did?
I did what they call the HCG Diet.
Okay.
And HCG stands for human chorionic gonadotropin, the pregnancy hormone. Basically, the pregnancy hormone does three things with your diet. It keeps you from plateauing, which is the most important thing. Most people, when they diet, they'll lose weight for a short time and then they will plateau and can't get beyond that point.
Yeah.
Well, this keeps you from plateauing. It helps keep your blood sugar normal.
Which helps you to burn the fat, or burn the energy.
Which helps you to burn the fat, but also keeps you from feeling the weakness that many people feel when they diet. Their blood sugar goes down. And also, it helps prevent the ravenous hunger. Now, of course, to eating, there's a certain amount that just is mental, and a certain amount of discipline anyone needs to have that's going to diet.
Right.
But this keeps you from feeling the terribly ravenous hunger that so many people have.
You lost 40 pounds in how many days?
I've lost 40 pounds, and it's been about 32 days.
Wow.
Actually, my coat's a little loose.
Your jacket's a little, it's a little loose now.
I'm wearing different clothes now. I'm wearing much smaller clothes.
Yeah.
Now.
All right, well, patients Lori and Michael Parker, you two, were you battling the bulge as well?
Yes.
Okay, so you decided to do this. Did you believe that you would lose weight really on this when you heard it? Because it sounds kind of one of those things you're going, really? So all I have to do is take this hormone and I can lose this weight?
Yes, I did. I had a friend that told me about it, and she called me up. She lives in Salt Lake City. And she says, hey, I've dropped in 6 weeks, I've dropped 30 pounds. Wow. And I said, so this works? She says, yeah. So I went online and did my research, and I said, well, I want to be medically supervised and I want someone local. And so I found Dr. Kern online, and I've been very pleased.
Yeah, how much have you lost?
I've lost 24 pounds.
Wow. And your husband, how much have you lost?
I've lost 22 pounds.
22 pounds. Well, for once, the woman lost more than the guy. and so you're still wanting to lose more weight, or because you look great?
No, I'm where I wanted to be. I actually wanted to get off like 20 pounds. I had put on almost 10 pounds. And I wanted to get that off and have a 10-pound cushion. Yeah. So now I have my cushion. I'm in
so
my
you
size
can eat your way
8.
back up, or
no,
okay,
I'm staying where I am.
All right. So tell me how difficult this was to do, though, because you do need some discipline in terms of the caloric intake that you can have.
Yes, you do. Yes. It was not, for me, it wasn't very difficult. It's more of a mind thing. So getting past, probably the most difficult part was the first 3 to 4 days, and basically your body is going through a detox. And I started this right after the holidays, so I was trying to get all the sugar out of my body, all the starches I had eaten. So the first 3 to 4 days were, I was not in a good mood. Yeah. Needless to say.
But then you got into that zone and you realized what you were trying to do, and this has made it easier because you didn't have, like he's saying, that crash where you suddenly want to eat everything out there.
Exactly. And the fact that you actually, I like the fact that there is a chart that you do, and you actually chart every day. And the fact that I'm getting on the scale and I'm actually seeing you lose approximately anywhere from 1 pound to 2 pounds every day.
Yeah.
And keep in mind, I was not exercising because I had foot surgery. So
wow.
I was not able to exercise while I did this. And that was one of the reasons I was so adamant about doing it, because I didn't want to put on extra weight while I was sitting on my behind.
Yeah.
So.
Well, okay. Well, you look fantastic. All right. There are other ways to get rid of some of the extra weight. Liposuction is not really looked at as a weight reduction, but more of a contouring.
Yes,
but you all do that as well.
We do that indeed. Body sculpting, if you care. And we have several methods that we can do that. It is a type that we can do under what they call tumescent anesthesia. So the patient does not go under general anesthesia. We are able to talk during the procedure.
Right. You can also harvest the fat or take the fat, right?
And that's really the new interesting part of this, and it's because of advances in stem cell research and technology that we can actually harvest the fat, literally take it from where you don't want it anymore and put it where you would like to have it. And this is a interesting device that we can explain here, because now we're doing a lot of pulling the fat from where you don't want it and now putting it back in to your breasts.
So this is used basically to...
Somebody said, oh, well. Yeah, so you're not putting in an implant, using your own fat.
This is used to expand the skin of the breast. It also augments the circulation in the breast, so that when we do put the fat in, then there is more blood circulation feeding this fat to help you retain it.
Yeah, yeah.
Now, also the amazing thing about it is that we can now take women who have had mastectomies, and using serial fat transfers to the breast, we can reconstruct a breast for them, rather than using silicone or saline bags.
Right, since it's their own fat, then they're not going to reject it.
It is their own tissue. There is nothing to be rejected, and it should stay at least 80% of this fat that we transfer should stay for the rest of their lives.
All right. Also getting ready for summer. Tony, tell us about the hair removal and the spider vein removal.
Oh, yes. A lot of folks don't know that it takes a little bit of time to get things like your veins, taking care of little spider veins, or doing hair removal. It's not a one-shot deal, not a one-treatment thing. So now is the time to go ahead and do the summarizing of your body. So if you have hair, fur where you don't want it, and a little bit of leg vein, now's the time to go in, because it's going to take a few treatments.
So by May, June, you'll be looking hot.
That's right. Get ready. Get ready now.
All right. Thank you very much. For more on all the treatment options at the Image Enhancement Centers, you can call them at 713-774-6243, 713-774-6243, or find them on the web at imageenhancementcenter.net. And everyone in our audience today is going home with a $50 gift certificate to use at either Image Enhancement Center location. There's one in Houston and one in Katy as well.